Afternoon at 2.
Your showdown station.
1230 KCOH.
Yep, it is KCOH Houston. The program is in the mix, and mixing it up with us this morning, the very lovely, the very talented, she's just well educated and well informed, got hands, gifted hands. She's Dr. Karan Wade.
Good morning, Mike, and thank you for all those accolades. Thank you so very much.
Well, you've done it. You've gotten the training. A former nurse who decided she wanted to be a dentist, and you have those steady hands and good eyes where you can go in there and just, who is it? Like basketball players can sink those shots.
Oh,
you
yeah.
can drill those.
All net.
Yeah. You know how to go in there and just drill those holes in our teeth and drill them into our gums and jawbones and stuff, and do what it takes to keep us going.
Well, I try, Mike. I try to do what I need to do to keep everyone's oral health at its pinnacle, so to speak.
Well, I was thinking drill something into my brain and make it at its pinnacle.
Okay, that's outside my area of expertise, but we might have to look that up and see if we can find you somebody, Mike.
All right. Well, what is on your agenda for today?
What's on my agenda for today? Well, I guess I wanted to just talk just a little bit briefly about patients who have sickle cell anemia. And patients who have sickle cell anemia, that's a hereditary disease, and that's passed on either from the mother or father. And if the father has like the gene and the mother has the gene, more than likely the child could possibly have be born with sickle cell, exactly. Yeah. And if even maybe just one parent has it and the other parent doesn't, they could just be a trait carrier. But I would just want to let people know that patients who have sickle cell disease, since they're on a lot of medications and they have a lot of physical problems, that they should be more in tune to seeing their dentist twice a year, sometimes maybe even more than that, because sometimes they, because of the types of medications that they're on, or if they're on an increased amount of medications, they could have some side effects from the medications, such as dry mouth, which would make them more susceptible to getting decay in their teeth. So I just wanted to remind our listeners, if you know anybody, or if you yourself have sickle cell anemia, that you might want to just be think about coming in to see your dentist, come by to see us at our office, or you see your dentist, but you need to just keep that in the forefront of your mind if you have any sickle cell anemia or any other health problems, that you might want to see your dentist, because a lot of times when people on medications, a lot of medications will cause side effects. Some patients who have epilepsy, and they take some medications, and those medications will cause their gum tissue to overgrow, and that will cause them to have an increased amount of oral health problems.
Gum tissues overgrowing?
Mm-hmm. Patients who have, it's real common in patients who take Dilantin. Dilantin is an anti-seizure medication, and that one of the side effects of that.
I know Yvonne takes Dilantin, but I don't see that.
It's not guaranteed that everyone will have it, but that is a side effect of in some patients, that patients who take Dilantin, it could cause their growth, and it could be the amount of dosage that they're on that could cause overgrowth, but it can cause the gum tissue to overgrowth. It just hypertrophies, and that means that it just grows. Yeah, it gets
actually
thicker.
Had something like that happen with my finger one time, which was really. I cut it in shop, fixing a lawnmower.
Right.
And when it grew back, it actually grew and covered the part of my nail. Really? It was bleeding, red, and
right.
all of that. Had to go back to the doctor to have him burn it off. I thought I had cancer or something. I'd never seen that before.
Really?
It's amazing what the body can do.
It is amazing, and it's kind of like the body's trying to heal itself sometimes, and sometimes when it's trying to heal itself, it causes more problems. But sometimes it's just the body's reaction to, I guess, an injury, and it's just trying to heal itself.
And so Dilantin can make
Dilantin can cause.
Overgrowth means that you have less teeth and it's covering your teeth.
No, you don't have less. Well, I guess your teeth are still there, but it can cover up your teeth. Yes, it can cover up your teeth, and you just have to have that tissue cut back. Yeah. And it's not every patient that's on Dilantin will have that, but that is a side effect that could happen in patients that do take Dilantin. And some other drugs that anti-seizure medications, some of those drugs can cause other problems and side effects and things like that too.
Well, You reminded me of something that used to happen. Thank God it doesn't happen that much anymore. But I guess it was the side of my mouth would swell, and it made it more likely that as I chewed, I would bite the side of my mouth. And I went through that for quite a while.
Did you have some teeth missing out, tooth taken out in the area or anything like that?
No, I had my wisdom teeth
taken out. Yeah.
And so you think that might have...
It's possible. Sometimes your gum tissue is very pliable and it just likes to go wherever it wants to go. And just say, for example, you had some teeth taken out on your cheek side, on the top right side. Your cheek will fall into that little space, okay? Because your teeth actually support your lips and your cheeks and things like that. And when you have a tooth that's removed, what happens is the cheek tissue will fall into that space, and that could be a reason why that you were biting your lip or your cheek back there, because your cheek was being supported by your wisdom teeth back there, and now that the wisdom teeth were gone, the cheek tissue can just go wherever it wanted to go, and it fell in that spot, and if it just happened to have fallen into an area where you were occluding or chewing in an area, and you probably were biting your cheek until the cheek got used to that tooth not being there, and then it kind of like say, okay, I'm not gonna go in anymore. So yeah.
Well, it took it a long time to get used to it.
Yeah, but then that is possible. That happens. I mean, sure, you've seen people who don't have any teeth and how their mouth is kind of like folded in on itself and things like that. It's because your teeth actually support your lips and your jaws and the upper part of your cheek. And so if it's nothing there to hold them up, it's going to kind of like fold in on itself.
Whoa.
Yeah.
Okie dokie. Well, I wondered about that.
That's probably what it was. I mean, just like, for example, I had a patient recently. I gave him did a partial for him. He had some teeth that were missing in the top and in the front and in the back. So when I gave him his partial, he was chewing. He kept saying he was biting the side of his cheek. And the reason why he was doing that, he had teeth at the bottom, but he didn't have any at the top. But his cheek had repositioned itself in the line of where he would be chewing. And so every time since I put his partial in, he kept biting his cheek. But until his cheek got used to those teeth being there, he was going to continue to do it until the teeth just got used to that area.
Boy, I feel sorry for him because that hurts.
It does hurt. It does hurt. It really does hurt.
And it can set up an infection.
It can if you keep biting the area and causing inflammation in the area. So. But anyway,
we live such exciting lives.
We live such exciting lives. We really, really do. But if any of your listeners would like to give us a call, you have any dental questions, feel free to give us a call. And Mike is going to give you that number because I can't ever remember that number.
The number is 713-526-1230.
You sure?
Yeah, because I thought about the old number, when we were 1430, it used to be 1430. Now it is 1230, so 713-526-1230. And if you are out there and you have any questions about your oral health, your dental health, even related to the tongue.
Well, that's a part of the mouth. Your tongue, your tonsils, your throat, that's all a part of the head and neck.
Well, you have someone here who can answer your questions and answer them correctly 99% of the time.
And if I don't know the answer, I surely will look it up and I will have the answer for you when I come back the next time. But if you want to come into our office, feel free, and I'll give you the phone number. The office phone number is 713-654-7756, 713-654-7756. And we're located at 2101 Crawford, right there on the corner of Crawford and Webster, Crawford and Gray. If you have some health dental concerns and you want to come in, we do free consults. So you can call the office and tell me you would like to come in for a free consult, and we'll take a look at you and do some x-rays and let you know what's going on, and you can proceed from there.
Okay. Well, you have 3 callers right now.
Okay.
Derek, an unidentified caller, and James, and we will take them in that order. Good morning, Derek.
Good morning.
Yes. How you doing today? I have two questions, quick questions. Okay, now I want to find out about weekends, and I talked to you first. The reason I didn't call last week, you said something about you don't do root canals?
No, that's not what I said. I said I don't do root canals that are, they may be difficult root canals, or if I can't see the canals, our office do root canals, but sometimes they might be outside of my scope, and I will refer you. But we do root canals at our office.
Okay, I'm glad I got that straight because I like listening to you, and I was, ready to come and see you, but maybe sometimes we get a little older, we don't hear it.
Yeah, I asked her about some specialty stuff that had to be done over, and she said,
if it's like a retreatment on a root canal, I don't usually do those. I usually refer those out to the specialist.
No, it's one that got to be done in order to hold my partial.
Okay, well then that one, yes, sir. That would be something that would be in my scope.
Yes, the other one that they did, they cut it too small for the crown they put on us, so the crown kept coming off.
Right.
Crown. So that one is going to have to be redone to the point that I'm going to have that teeth put in that was partial.
Yes.
Those partials got platinum in it.
Right.
So I'm glad I got that, and I will see your number, and I will be seeing you soon. Within the next week, I promise you that.
All right, I appreciate it. Thank you so much.
all right, have a great day and good luck with, well, not good luck, just get the right professional and everything will be okay. Okay, caller, you're on with Dr. Karan Wade.
Hello.
Hello?
Yeah, how you doing this morning?
Oh, I'm doing great. I got a question. I'm a first-time caller, but I have a question. I had a root canal done on my my front teeth.
Mm-hmm.
But not a root canal. I mean a crown I had on my first on my front teeth.
Right.
And so that crown is bigger than my original teeth, and it's sticking out more than my regular teeth.
Okay.
So I want to know, do I need to get that crown filed down so it can match my original?
Well, that's hard to say without looking at you. I mean, you can do some adjusting on crowns that may or may not, that may be too big or too long or too wide. But most of the time, you really have to have those crowns replaced. If it's too big and it's sticking out and it's not in the same plane as your natural teeth, I would recommend you probably need to get it changed. But you can feel free to come by the office and let me take a look at it, and I can let you know whether we can adjust that crown, that your existing crown, or if we need to take that one off and do a new one.
Oh, okay.
Okay.
It's not really too big. It's just sticking out longer than my original tooth. And
Okay. Well, if it's longer, sometimes we can file those back. If it's just a length thing, we can adjust those back. That's an easy fix. But if it was too wide or if it's too bulky, that would be something a little bit different. But if it's just too long, yes, sir, we can usually cut those back. Okay.
Oh, okay. Well, thank you very much.
Oh, you're very welcome. Thank you for calling.
All right, James is up next, and David will follow James. And James, you're on with Dr. Karan Wade.
Good morning.
Yes, hello.
How you doing today? What's your question?
I'm good. Be darned. Dr. Wade, I was calling to find out if you do implants.
Yes, we do. We do implants. We sure do. Okay. So, you can come by the office. Like I said, we do free consults. So if you're, I'm not sure how many you need or if they're in the front or in the back. But if you want to come by the office, we do free consults. We'll take an X-ray, see how much bone you have there, or if you have enough bone to hold the implant there, and we can just go from there.
If you don't have enough bone to hold the implant, what happens then?
Well, if you don't have enough bone, there are two things there. Sometimes we can do some bone grafting. It just depends on how much bone you have lost in that area. Sometimes you can do bone grafting and put the bone grafting in. Once the bone grafting is placed, it takes about 4 to 5 months for the bone to grow to adhere to your remaining bone and or your tissue, and then we can go from there. But it's kind of hard to give you an answer over the radio, but I really would need to see you. So like I said, you can come by for a free consult and let me take a look and see what your bone level is there.
Okay, I'll make an appointment.
All right, then. Thank you so much for calling. Thank you.
All right, thank you. One quick note here. There has been a settlement made in the Robbie Tolan case. There will not be a trial.
Oh, really?
This just came from Fox.
Mm-hmm.
Don't know what they settled for, but
probably won't know that.
Well, yeah, it depends if
it's sealed or not.
Yeah, but anyway, I guess Robbie will get paid.
Yes, so.
And he may not want you to know how much he's got to get paid. Anyway, David, good afternoon to you.
Well, good afternoon. Martha Harris, Dr. Wade, how you doing?
I'm doing just fine.
That's good. I was just kind of giving you a call just to say I want to thank you again for the work that you're doing to me and for me. I really appreciate it. more than ever. I just wanted to call and let you know I'm with you all the way. Thank you.
Okay, well, I appreciate you calling in. It's my pleasure to be able to take care of you and restore your dental health because we want you to have that movie star smile.
Yes, ma'am. Yes, ma'am.
Okay.
All right, well, thank you.
All
Have a
right.
good
Thank you
day.
for calling in. You too. Bye-bye.
Okay,
You're
well,
welcome.
thank you. Dr. Karan Wade is in the house, and if you have a dental question, she will be here for another 8 minutes. So get your call in now. This time is really flying by.
I know how time flies when you're having
fun. And you have another
At least
caller.
that's what they say.
Yeah, 713-526-1230, 713-526-1230. And it's always fun being in your presence, Dr. Wade. Hello, caller.
Hi. This call is not dental related.
Mm-hmm.
I didn't realize I had called in on the live line.
Okay, well, this is a live line. It is a dental program, so there's no problem. But we can't help you right now. Don't mean to be, but we have to keep up the proper decorum. If you're trying to reach the front desk, they had a number here. There it is. Call 832-756-4607. 832-756-4607. All right, and we have another caller here. Hello, caller.
Yes, hey, I was calling. My dentures that I had, my partials, they're not fitting anymore. I need to really get them reset
Okay.
or whatever, or get a new pair of partials. And also my bottom set is my tooth under it has started to look like decay. And I'm wondering, can you help me with that?
Well, I'm most likely we can. You just need to come by the office and let us take a look. Usually when you've had dentures and dentures get, if you had them for a while, what happens is when you don't have any teeth, your bone starts to resorb, and that means it starts to shrink down. And so if you've had dentures for a while and you've been wearing for several years, sometimes you'll get what we call bone resorption, and that just means that the bone is starting to shrink down and your dentures don't fit anymore. Sometimes we can reline them and make them fit a little bit better, and then sometimes you just have to get a brand new set, just depending on how much bone loss that you have in that area. Okay?
Okay. Can I call 9, try to make an appointment and give them my insurance information?
Yes, sir. You can give it. Let me give you the office phone number. It's 713
Okay.
654
Okay.
7756. And someone will take your appointment, and you can give them the insurance information. We can go from there, okay?
Okay,
All right. Thank you so much for calling.
All right. 713-526-1230 is the number here, 713-526-1230. Now, if I have a problem with the enamel, because I keep seeing these commercials, and we talk about things that will cause the enamel to come off your teeth, like lemons and et cetera, et cetera.
A lot of acidic foods and
sodas,
those sports drinks, anything that's high in acid will cause your enamel to start to erode away. Some people have a habit of clenching or grinding their teeth, and that'll cause the enamel to thin in some areas and sometimes even break or crack. So some of those toothpastes that they have advertising, can't tell you to the extent of how that they replace the enamel, but they actually strengthen the enamel. They don't really replace the enamel per se, but it will strengthen the enamel and make your teeth more resistant to the acids and things that you're eating or drinking. The best thing is that if you have a diet that's high in acid, the best thing is that you make sure that you're either cut that back or that you're at least rinsing your mouth out with water if you're somewhere where you can't brush, to remove some of that acid that's remaining, the residue that's remaining on your teeth after you're drinking or eating lemons. I know a lot of people eat lemons and things like that, and really bad for your teeth.
And so how do you know when your enamel is endangered, when it's too thin?
When it's getting thin? Well, sometimes you can tell just from looking at it, and the other way you can tell is go into your dentist and let your dentist take a look and see. I mean, some people have a lot of sensitivity. They get cold or sweet sensitivity most of the time, or like if they drinking something or eating something that's kind of sour, they'll get some sensitivity. And in our teeth, we have, just like we got pores in our skin and our teeth, we got what we have called dental tubules. And sometimes if those dental tubules are open, it's kind of like a direct pathway from the outside of the tooth directly to the nerve, and you will get some sensitivity. Same premise if you have a cavity or hole in your tooth, it's just like it's a direct pathway into the nerve. So if you have some sensitivity, that sometimes may be an indication that your enamel is thinning.
All right. Would getting those caps help?
Getting crowns, yes, that will help. Sometimes it might be necessary for you to get some crowns if your enamel has thinned so much that it's, you're just having a lot of sensitivity or you're having pain. That will help because that will, of course, protect the tooth.
Okay. Just wondering. It's not a problem that I have.
Not a problem that you have. Just wondering, huh?
Yeah, well, I hope to never
just one of
have
those
it.
aha moments, right?
No, well, but when you hear people talk about it and you wonder because the older I get, the more things, crop up, and I don't want to discover one day that I'm losing my teeth, and all of a sudden.
Well, no, I mean, a lot of times people, they take their teeth for granted. They just think, oh, they're just teeth, and they don't have to, go to the dentist or check on them or anything like that, and you don't miss them until they're gone. And if you don't take care of your teeth, they will go away. They will. They'll just move on out.
Yeah. And so we just want to make sure. All right, we don't have that much more time, so if you have a question for Dr. Karan Wade, got 2 minutes.
2 minutes. Well, let me give you the office phone number again. The office phone number is 713-654-7756. 713-654-7756. And don't forget, we're still running that $99 special for those of you out there who don't have insurance. For regular cleaning, you can come in for an examination, x-rays, and a regular cleaning for just the $99. Okay?
Just the $99. And I want you to know, parents out there, that one of the first things that Dr. Wade said today, she was talking about the bus accident that thus far has claimed the lives of 2 children.
Right, right. That was really, really sad, and we just need to all keep those families in our prayers. And, because, you never know. You just never know, when the last time you're going to see your loved ones.
Right.
Be going to work, going to school, or anything like that.
I had a cousin who drowned. She was from Galveston, and she went up to the country.
Mm-hmm.
And I went back to Galveston, and she drowned the next day.
Wow.
And I never saw her again.
Yeah.
That
this is amazing. Life is just so short. And sometimes we get up and just take life for granted, and, we're here one moment and gone the next.
And I was too poor, of course, to go back.
Mm-hmm.
There was no room in the car.
Right.
And so I just never saw her again. And I don't even know, I don't even remember seeing her, tombstone or anything.
Right.
Death is so final. It can come so early. It can come to anybody.
Exactly. I mean, I remember even from in high school, I remember we had just come back from being out on our summer break, and it was this young man who sat like 2 rows ahead of me, and he went swimming and he drowned. And when they had said it during the summertime, I knew exactly who he was, but it was just so final when we went back to school and you didn't see that person sitting 2 rows ahead of you, and you've been seeing them for all these years that you've been going to school. So you're right, death is so final, and it can come at any moment or any time.
And so take care of yourself, live life to the full. And really, if you love somebody, and we should love everyone, never leave with anger,
right.
and malice and all that in your heart. That's why I call myself the love man. So, Dr. Wade, let me give you my love and my appreciation for all that you do. And we look forward to seeing you when we...
In about 2 weeks.
See you. Okay.
All right. My love to you too, Mike.
All right. Give us
Bye-bye.
that address and phone number one more time.
The address for the office is 2101 Crawford, right there on the corner of Crawford and Webster, Crawford and Gray, across from St. John's Church. And the office phone number is 713-654-7756.
All right.
And I'll see you next time.